Hello, welcome to our frequently asked questions. Today I'm answering a very frequently asked question about upper blepharoplasty. What are the risks of having upper blepharoplasty or an upper eyelid lift? And in answering this question, we will talk about what are the common things that can happen during the recovery, what are uncommon risks, what are very rare risks but nevertheless serious risks, and then we'll talk about how you can reduce those risks. And for most people, eyelid surgery is a very successful surgery and risks are relatively low, but we'll talk about how you can reduce these risks to ensure that you have a fast and successful surgery. And then we'll also talk about factors that may influence the surgery, and we'll talk through these in length. So, my name is Dr. Julian De Silva and I am a London-based facial, cosmetic and plastic surgeon, and blepharoplasty is a common procedure that I perform every day for my patients. And the information that I'm discussing with you today is information that I share with my patients on a daily basis. So in terms of what are the risks from eyelid surgery or upper eyelid surgery, well, what are common things that can happen, which are swelling, bruising, and occasionally a degree of numbness in the eyelid. Well, swelling is a normal part of healing and every patient has some degree of swelling, but often this can be the most visible thing a week after surgery. And for most patients, 80 to 90% of that swelling will actually go over the first week in an upper blepharoplasty. However, there are measures that can also be taken to speed that up further. Bruising, well, in terms of treating my patients, less than 10% of patients have bruising from upper blepharoplasty. However, again, there can be measures that can be taken to reduce that further. Bruising can be frustrating because often 1 week after surgery, that can be the only true sign that you've had any kind of intervention. And so there are measures that can be taken to reduce that. And finally, in terms of numbness, well, every patient has some degree of numbness in the upper eyelid after upper blepharoplasty, and in a way this is a normal part of healing and does recover completely, but it can take anywhere from 6 weeks to 6 months to completely resolve. So let's talk also a little bit about uncommon risks. And uncommon risks includes factors such as dry eyes, and the majority of patients do not have dry eyes as long as measurements are done before the surgery and specific checks are done in order to reduce those risks. But less than 5% of patients can have a period of dry eye, and that dryness generally will last a period of weeks, but rarely can last for a period of months. There are other additional factors in your medical history that may increase the chance of dry eyes, and it is important when considering eyelid surgery that these are taken into account, and these include previous laser refractive surgery, a known history of dry eyes, or certain medical conditions that can be associated with dry eyes. So then another factor that we should consider is discomfort, and many patients are worried that they may have pain or discomfort after surgery. Well, certainly in my patients having upper blepharoplasty, the great majority of patients have minimal discomfort after upper blepharoplasty, and over 50% require no analgesia or no pain relief after their surgery. However, everyone is different, and there may be a degree of discomfort the first 24 hours or 48 hours after surgery. However, this is generally more an ache than a serious pain in the majority of patients. Other things that are relatively uncommon are things like eyelid cysts, and these sometimes can occur after surgery around the eyelids, and these tend to be a tiny little ball or tiny little cyst in the skin as it's healing, and these are quite remedial with a drop of local anesthetic and removal of the cyst. So let's move on to rare but serious consequences of blepharoplasty, and the most serious consequence of upper blepharoplasty is a damage to the vision, and this is a very rare complication from upper blepharoplasty surgery, and certainly in my patients I've never experienced this. However, these very rare events that are a fraction of 1% they do require caution, and they're measures that I take with every single patient before the surgery, during the surgery with surgical technique, and after the surgery to ensure that nothing like this happens. And generally speaking, if there was severe discomfort or a drop in vision, it would happen very soon after the surgery, and as long as action is taken soon after the surgery, it is something that is quite treatable. Other things that are relatively rare are scarring, and the scars from upper blepharoplasty can generally be hidden in the natural crease of the upper eyelid. However, less than 1% of the population can have issues with scarring, and although this is relatively rare, factors such as keloid scarring, well, it could be a factor for certain patients. And if you personally know that you tend to have more visible scars, then this is certainly something that you should discuss with your surgeon before surgery. However, in the majority of patients, the scar can be naturally hidden in the natural crease of the upper eyelid to a large extent. Other factors such as allergy and infection, well, these are generally very rare after upper blepharoplasty, but precautions can be taken in order to reduce those chances even further. Factors such as antibiotics that are given before, during and after surgery, well, these can reduce the chance of infection even further. We've talked about common, uncommon and very rare issues with upper blepharoplasty. A further consideration is expectations, and all of us have a degree of asymmetry in our faces, and most people have a slightly smaller side and a slightly larger side. And although with upper blepharoplasty some of those asymmetries may be reduced, it's fair to say that it's not possible to complete eyelid surgery and have perfect symmetry after the surgery, and this certainly goes with more complex surgery such as revision surgery, as in these cases there will be more scarring and changes in the natural anatomy. So let's now talk about what measures you can take in order to reduce these risks from undergoing upper blepharoplasty, and what you can do to ensure that you have the fastest possible recovery and the best possible result and reduce these risks as far as possible. So perhaps the most important factor in terms of reducing risks is the surgical technique and choosing your surgeon. And so I would encourage you to do research when choosing your surgeon in order to ensure this. And I would encourage you to ask your surgeon about the surgical technique involved, about the potential risks or downsides of surgery, and what measures can be taken in order to reduce those risks. And it's fair to say that there is no surgeon who's practicing blepharoplasty that has no complications. And so it's a question of how the surgery is performed and what measures your surgeon is going to take to ensure that those risks are as small as possible. And it's fair to say in upper blepharoplasty, most patients are very happy and the surgery is very successful from surgery. However, there are measures that can be taken in order to reduce these risks as far as possible in order to ensure that you have a successful result. Other measures that are important are your general health, and certainly there are certain medical conditions that can be associated with higher risks from surgery. And so, for example, having high blood pressure or borderline blood pressure, well, it's absolutely key that your blood pressure is controlled before the surgery to ensure the risks are minimal. Other factors such as dry eyes or having previous laser refractive surgery, and there are other factors as well, well, it's important that these are taken into consideration before surgery. And in such patients, I do additional tests to test tear function before the surgery to ensure that you don't have issues such as dry eye after the surgery. Other factors that are important are avoiding certain medications or herbal medicines before and after surgery, and I give all patients written instructions over what should be avoided to ensure safety in this way. If you've had previous surgery and are undergoing revision surgery, because there will be some scar tissue from the previous surgery, there will be some change in the anatomy from previous surgery, and so there is a relatively higher chance or higher risk associated undergoing revision surgery. And there are measures that can be taken to reduce this, and these are factors that should be discussed with your surgeon. In summary, we've talked about a number of things regarding risks in upper blepharoplasty. We've talked about common factors that can occur during the recovery, such as swelling and occasionally bruising. We've talked about less common factors or less common risks, and we've also talked about how to reduce those. And we've also talked about very serious events that can occur with eyelid surgery and how those can be reduced. And we've talked about factors that are most important in terms of a successful outcome from surgery, including surgical technique, your past medical history, and following your doctor's instructions. And following your doctor's instructions before having surgery and after surgery are very important in terms of ensuring a fast recovery and a successful outcome. I hope this information has been useful for you. Thank you for watching. If you would like further information about having blepharoplasty or eyelid surgery, please have a look at Dr. De Silva's book. This is a comprehensive patient guide with over 250 pages, including color illustrations and photographs, including all commonly asked questions and fears that patients have. This is available through either Dr. Julian De Silva's website or by searching on Amazon.